This is called a sterile field. Only the surface of the draped back table is considered sterile. Everything below table level is considered contaminated. Any sterile item that comes in contact with a non-sterile object or falls below table level is considered contaminated and must be discarded and replaced.
4, 5, 6, 7, 8.
The circulating nurse and scrub person count the instruments, needles, sponges, and sharps at various stages of the surgical procedure to ensure patient safety. While the scrub person continues preparation for the procedure, the circulating nurse interviews the patient in the holding area.
My name is Susan. I'll be your nurse for your surgery.
It is important that each member of the team introduces themselves to the patient.
And ask you a few questions. Could you tell me what's your name?
Bob Smith.
Okay.
By reviewing the chart, the history and physical, anesthesia note, and the nurse's notes, the circulating nurse learns more about the patient's medical conditions and concerns. The nurse shares specific information with the other members of the team as necessary and continues the plan of care.
Hi, Mr. Smith. Good morning.
Good morning.
I'm Dr. Singh, from anesthesiologist. Okay? I'm going to take care of you today.
Okay.
The anesthesia care provider discusses the type of anesthesia which will be used and obtains the patient's consent. He or she explains how it will promote comfort during the surgical procedure.
Take a nice deep breath. One, check your back here. Okay, take a nice deep breath. Okay, can you give me a small cough? Okay, then once the procedure finished off, then we take the tube out and then we'll take you to the recovery room. Okay?
Good. We're going to take real good care of you. Did you have a good night's sleep last night?
Yes, I did.
Good. You ready to have the ventral hernia taken care of today?
Yes, I am.
Okay. Do you have anybody here with you?
The surgeon also visits with the patient before surgery and answers any remaining questions.
I'll go out and talk with her and explain to her how everything went. You're in good hands and we're going to take real good care of you.
Good.
Do you have any questions I can answer for you?
Just how long will the surgery take?
Right now it's scheduled for about 2 hours.
2 hours. Okay.
Yes, but once we get you into the room, there's a couple of things that we need to do to prepare. We need to position you on the OR bed, and anesthesia will put monitors on you, and we'll give you an oxygen mask so you can breathe in some oxygen. And also, we'll have to wash the area.
Okay.
Okay, so just a couple of things that we need to do before we actually get started.
Okay.
But on a whole, it should take approximately 2 hours.
2 hours. Okay.
Okay?
The operating room assistant is another member of the OR team. One of the possible duties of the operating room assistant is to assist in the transportation of patients to the operating room. It is important to have enough personnel available to transfer the patient safely. The operating room is a unique environment with its own customs and language. As the patient enters the operating room, a special emphasis on infection control and asepsis begins. Some patients need additional help. It is recommended that a minimum of 4 people be available if the patient cannot move on their own or is anesthetized. A safety strap is a reminder to the patient that the OR bed is narrow. Arm boards, a pillow, and a warm blanket help keep the patient safe and comfortable. The OR environment tends to be quite cool, so a warm blanket is appreciated.
I'm going to put leads on your chest. It's a little cold. Bear with me.
The anesthesia care provider will use a variety of monitors to assess the patient's physiological responses and will document them throughout the surgical procedure.
Okay, can you keep your arm right here? Okay, Mr. Smith, I'm going to put an oxygen mask on your face, okay? It's a clean oxygen air to give you a little more oxygen in your lungs, okay?
All right, Mr. Smith.
When the anesthesia care provider begins the process of anesthesia, the patient needs a relaxed and quiet environment. The circulating nurse remains at the patient's side to assist the anesthesia care provider and reassure the patient.
Find a dreamland to sleep when you will see you when you wake up. We're going to take good care of you.
You're doing good. Take a deep breath.
As the patient falls asleep and sensitivity to noise increases, the surgical team should avoid talking loudly or making unnecessary noise. After anesthesia induction and intubation, the team positions the patient so that the incision site is easily accessible. The circulating nurse pads areas which need additional protection from injury, such as nerve damage. The circulating nurse uses sterile sponges and an antimicrobial solution to remove as many microorganisms from the incision site as possible. This procedure is called the skin prep. The skin is the body's major protection against infection. Once an incision is made, the patient is at risk for an infection. The team must ensure that every item placed on the sterile field is sterile. Every member of the sterile surgical team, including the scrub person, surgeon, and surgical assistant, must perform a surgical hand scrub to reduce microorganisms on their hands and arms. The circulating nurse and scrub person assist the surgeon and the surgeon's assistant to don sterile gown and gloves. The assistant may be another physician or an individual specially trained to assist, such as a registered nurse first assistant. The surgeon places sterile towels around the incision site and covers the patient with sterile drapes to complete the sterile field. This will aid in protecting the patient from infection. Before beginning the procedure, the entire surgical team pauses for a timeout to identify the patient and to confirm the procedure being performed. The circulating nurse sets priorities and makes decisions in managing and coordinating the nursing care required for each patient. The circulating nurse anticipates the needs of the surgical team and organizes the environment to provide safe and effective patient care.
2, 3, 4, 5.
Thank you.
The scrub person watches the procedure closely and anticipates the surgeon's needs. This requires knowledge of anatomy and physiology and understanding the sequence of the surgical procedure. This allows the surgeon to concentrate on the procedure. The circulating nurse monitors personnel coming in and out of the room and ensures that no one comes in contact with a sterile field. Nursing interventions and patient outcomes must be documented on the intraoperative record throughout the procedure.
We're going to have a frozen section soon.
Okay. Dr. James, you ready for the mesh?
Yes, I am.
I have 6 by 3 or 12 by 12.
I like the 6 by 3 mesh, please.
The circulating nurse anticipates and responds to the needs of the team.
Jim, I need to step out or get something. Do you need anything before I do?
No, I'm okay.
Before leaving the room for any reason, The circulating nurse ensures that the scrub person needs no additional assistance at that time. The circulating nurse communicates with the family. This contact may help reduce the family's anxiety.
Hello, this is OR4. Is Mrs. Smith there? Would you please tell her that patient in OR4 doing fine, everything went well, and we're going to be finished soon. When we're finished, Dr. Jane's going to come out to talk to the family. All right, thank you.
During some surgical procedures, other healthcare providers participate in the care of the patient. Technicians from radiology operate equipment when X-rays or fluoroscopy are needed intraoperatively. Throughout the procedure, all members of the team work together. Teamwork includes knowledge of capabilities and responsibilities, communication skills, respect for one another's needs, and the willingness to work together for the benefit of the patient. The circulating nurse and the anesthesia care provider accompany the patient to the post-anesthesia care unit.
Hi, Jane. This is Mr. Smith, Dr. James' patient from room 3.
All right.
Where he's going?
The anesthesia care provider and the circulating nurse give the report to the post-anesthesia care unit nurse, who continues the patient's care during the immediate post-operative period. The patient will remain in the post-anesthesia care unit until the discharge criteria are met.
Then we start with it. His hemoglobin is 10.8.
All right.
His ABG were okay.
Yeah, I'm going to remove your masculine bag. Did you say off?
The surgeon informs the patient's family about the procedure and explains what to expect during the post-operative recovery. When the patient leaves the operating room assistants clean the operating room equipment and return everything to its proper place. Surgery is a complex and coordinated team effort with many people involved. The surgical team provides quality care and confidentiality of all patient information. The patient's comfort, health, and well-being depend upon every member of the team. Each person must do his or her job well. Communication and coordination among team members promotes a successful surgical experience and a satisfied patient and family.